Hi, Dr. Gooden. My name is Christian Buenviaje from the Bagel Bites.
Yes, sir. Bagel Bites.
Bagel Bites.
Bagel Bites.
And I'll be palpating these following bony structures of your hip joint and pelvic girdle. So up above here, above your pelvis, you have your iliac crest. It's like a little curve right above here. I don't want to palpate too much, because you know how it goes. Right below that, we have the anterior suprailiac spine, which goes down here, and then inferior iliac spine is more down there. Your sacrum will actually be posterior right here. It's like the last part of your spine. You can turn around if you like. It'll just be this lower section right here, kind of right by your butt crack. And then we have your greater trochanter, which would be up here. You can feel like the bony process up here. And then like a little more down is the lesser trochanter, which is also a little bony process that you could palpate if you like really palpate it really hard. And then your posterior iliac spine is really tough to like really palpate from the back because of all the muscles you have, but is just like right behind the iliac crest. And then your ischial tuberosity, don't want to harm my patient, but it is this lower part of your pelvis right here, like the curves down here of your pelvis. And then lastly, the pubic symphysis. If you put like the palm, like your wrist right here on your belly button, and you come down and you palpate hard, your pubic symphysis is right above your little private parts. So those are the bony structures. I'll be palpating the following muscles. So first we have the Iliopsias. It's hard to pronounce, but it's just above your iliac crest, which is that curve that I mentioned right above your of your pelvis, and that helps with flexion of the hip, anterior pelvic rotation, and anterior pelvic rotation is this one, I believe, and then external rotation of the hip this way. Then we have the Rectus Femoris, which is just all this interior part of your thigh right here, which also helps with flexion of the hip and anterior pelvic rotation. Next, we have the Sartorius, which actually goes from like your hip all the way down to the medial aspect of your knee, and that also helps with the flexion of your hip, the anterior pelvic rotation, and abduction of the hip. So abduction of the hip would be going out this way. Next, we have the Adductor Brevis, Longus, and Magnus, which are all on the medial part of the thigh right here, and are actually kind of deep, but not so deep. It also helps with adduction of the hip, which is coming back down to the middle. It assists with hip flexion, all except for the Magnus, which actually helps with extension of the hip. Mm-hmm. And then we have the Gracilis, which is actually like above, superficial to the adductor muscles, and it's just right along this medial part of your thigh, and that helps with adduction of the hip and internal rotation of the hip. Next, we have the semitendinosus and semimembranosus, which actually come down the lateral part of your thigh and the posterior part, and it helps with the extension of the hip, posterior pelvic rotation, and internal rotation of the hip. And then also we have the biceps femoris, as we like to call the hamstrings. And so this does extension of the hip, posterior pelvic rotation, and external rotation of the hip. Now I'll be palpating our favorite muscle in the body. It's called the Gluteus Maximus. Takes a lot of care. The Gluteus Maximus. I'm not actually touching it, Dr. Gooden. But it helps with the extension of the hip, posterior pelvic rotation, and external rotation of the hip. Just below that and a little bit deeper of the Gluteus Maximus, we have the Gluteus Medius. And that helps with abduction of the hip, so it would just come out. Hip abduction, which I already said. The anterior fibers would help with internal rotation, and the posterior parts will help with external rotation. And lastly, the last muscle that we'll be palpating for tonight is the tensor fascia lata. Latae. I don't know, it depends on how you want to pronounce it. But that helps with the Abduction of the hip. Good. And it goes along this way right here as I palpate it. Flexion of the hip and anterior pelvic rotation. What an honor it is to be doing this video with you guys. You guys have an amazing night, and check for the bloopers. Okay, all right. Hey, Dr. Girdle. I'll now be palpating a few muscles. So we have the Iliopsias, which is just above the iliac crest, and that helps with the flexion of the hip.